The brochures show you a serene infant sleeping in a sunlit nursery, but the reality hits at 2 a.m. You're standing in the dark, staring into a crib, listening to your newborn make noises that sound more like a malfunctioning engine than a human being. Those terrifying, unpredictable behaviors, the sudden jerks, the bizarre breathing, the random grunts, signal an immature nervous system adjusting to life outside the womb. Pediatricians navigate this chaos using a framework called the spectrum of concern. It functions as a clinical triage tool to separate harmless physiological glitches from genuine medical emergencies. Mastering these benchmarks allows you to trade a state of constant, exhausting panic for one of confident, informed observation. Every new parent eventually experiences the same terrifying moment. You're watching your baby sleep when they take a series of rapid, progressively deeper breaths, and then they just stop. This is periodic breathing. Because fetuses receive oxygen through the placenta, the newborn's brain and respiratory system are still syncing communication. Pediatricians expect these pauses to last under 10 seconds. The brain sends the signal, the baby takes a catch-up breath, and the rhythm resumes. Emergency intervention becomes necessary only if the pause exceeds 15 seconds, or if you notice bluish-gray lips or visible chest retractions, where the skin pulls in tightly around the ribs with every effort. Most irregular breathing patterns simply provide evidence of a developing neurological system actively mapping its environment. Then there are the physical misfires. A baby lying perfectly still will suddenly jerk their arms out, open their hands wide, and quiver at the chin. These symmetrical, violent motions look alarmingly like an infant seizure. This is the Moro reflex. It is a startle response triggered by an immature nervous system misinterpreting a sudden noise or slight shift in gravity. You can verify the situation using a simple pressure test. Normal newborn jitters will cease if you give the infant a pacifier to suck on, or if you gently hold the quivering limb steady. Actual neurological red flags involve rhythmic muscle jerking that continues even when the limb is physically restrained, often accompanied by total unresponsiveness. These dramatic physical misfires represent ancient evolutionary protective mechanisms firing up for the first time. Sleep is rarely quiet. Newborns produce a distressing array of gurgles, sighs, and congested dinosaur-like grunts throughout the night. Newborns lack the immediate reflex to effectively clear their throats, leading to a harmless pooling of saliva and milk directly above the swallowing mechanism. Combined with erratic REM brainwaves, this results in constant restless twitching, whimpering, and groaning during rest. Real respiratory distress looks quite different. Instead of a noisy sleeper, a baby in danger often shows extreme lethargy and a total inability to wake for scheduled feedings. A noisy, grunting baby is typically a healthy baby successfully managing their own airway. The physical intensity of newborn crying, the red face, clenched fists, and rigid posture, takes an immense psychological toll on parents. Crying serves as a newborn's sole biological mechanism for survival and communication. Many infants enter a phase of colic around 6 weeks of age. This involves periods of unexplained, extended crying that occur completely independent of the baby's basic needs. Clinical emergencies are defined by specific red flags: a sudden shift to a high-pitched cry, a rectal fever over 100.4 degrees, or forceful projectile vomiting. While intense crying is the primary stressor for parents, a weak, quiet, or lethargic infant is the greater clinical concern. The first few months of life constitute a period of aggressive biological transition from a perfectly controlled womb to a highly unpredictable outside world. Scary, erratic behaviors are the exact mechanisms by which the newborn's body learns to regulate its own vital systems. Using the spectrum of concern provides a tool for confidence, allowing you to rely on clinical benchmarks rather than hypervigilance. Understanding the physiological truth behind the chaos allows you to finally trade your anxiety for informed observation.